Hello, everyone who is joining us on YouTube. You're behind the scenes with our esteemed panel. We are just about to go live to our Zoom audience. Bear with us for a moment. All right, everyone, have fun today. Here we go. Greetings, everyone, and welcome. This is Eric Glazer, your host and moderator, and you have joined an episode of Bright Spots in Healthcare, produced by Shared Purpose Connect. Each episode, we bring leaders together to not only inform our audience, but also unearth bright spots, success stories at health plans, hospitals, and other various healthcare-related organizations across our country. Our goal is to identify as many bright spots or success stories as possible so that you can determine if the ideas shared on this show can be applied at your organization. We believe that this approach of finding a bright spot and cloning it is the most effective strategy to changing healthcare and improving healthcare in our lifetime. Our topic today is Medicare Advantage, novel approaches to whole person care. We have an incredible panel that you see in front of you. You are going to get a chance to read their bios if you haven't already. We sent them to you via email, but our producer, Sherry Keels, is about to post a link to those bios in our chat so you can get a sense of some of the great expertise that you are going to all benefit from. But from the interest of time, I will not be reading them. We will be introducing them by question in just a moment. Our sponsor today is our friends at Family First. They're the latest new innovative company to join the Bright Spots in Healthcare family. They are the first expert-led technology-powered caregiving solution for Medicare members. I'm going to tell you a little bit more about them later on in the show. But meanwhile, if you want to check them out online, they're at family-first.com. You could check them out and learn a little bit more about that great organization. Also, we have a Q&A module at the bottom of your screen. We do have a packed agenda, but if you ask your questions through that Q&A module and they fit within the flow of the conversation, I'll bring them up into discussion so you can kind of co-moderate with me. Otherwise, maybe our producer or our team of panelists will answer those questions via chat if we can't get to them. So offer you the opportunity to do that. And we will be sending you also a feedback form in about 40 minutes to your inbox. I ask you the favor of taking the 2 or 3 minutes of providing us feedback, not only on this session, but on the different topics you want to hear throughout the year. That's how we guide our programming throughout the year. And that's how we've been able to grow our audience and serve you in the healthcare market, as well as we have by taking your feedback, listening to you, and then producing shows like this. All right. Here we go. Let's get started. I'm going to put Dr. Grant Tarbox on the hot seat first. He is the Regional Medical Executive of the West and Northeast region at Cigna Medicare. So Grant, welcome to the show. I want to start talking about loneliness because that's such a key component to treating Medicare patients, and one that actually has a very cascading effect on all other social determinants. So can you talk a little bit about how loneliness is bringing down one's health and a solution that maybe you guys are implementing at Cigna to help combat loneliness for your Medicare Advantage populations?
Yeah, sure, Eric. Great question, and thanks. I appreciate the chance to be here. Your loneliness, it's hugely impactful in any population, definitely in the Medicare population. Actually, loneliness, interesting fact here, loneliness has the same impact on overall health as smoking 15 cigarettes a day. Right, according to a Cigna study. So 15 cigarettes a day is because you're lonely. People not only value, but they need social interaction, right? And the pandemic shuts so much of this down, particularly with our older population. One of the ways Cigna has worked to help address this social need was for us to partner with a company called PAPA. That's what you were referencing there too. PAPA is a program that's designed to bring in help for the activities of daily living of our members. So, I mean, this could be meal prep, transportation, chores, or just social time, right? They can sit there and chat or watch a movie together, and this is at no cost to the member. And currently, we offer this service in 9 states where there's a network of what they call PAPA Pals. That's what they refer to them as, where they've developed this network of assistance. Now, older adults, everybody, I mean, I think particularly older adults value their independence, right? Some of us younger adults, middle-aged adults take it for granted, but it's really valuable for the older population. And the outcome of this service is that it's actually helped them to age in place, which is everyone's goal. We want them to stay in our home as long as we can, right? But we also love the fact that there was an intergenerational aspect to this program. We had older people and younger people be able to come together and interact, right? They could socialize, they could learn from each other. The PALs actually also helped their members in the pandemic by making appointments for them when they were able to, but also teaching them how to use technology, right? And that's a big key for us because technology assistance actually helps leverage more virtual care. I know we're going to get into that later, but for the pandemic, another statistic I want to kind of mention here is before the pandemic, virtual health overall was roughly 1% of the visits that could be taken care of virtually, right? Now, 25%, huge jump. So the PAPA arrangement helps us address one of the pillars of health, right? There's three primary pillars. We got physical, mental, and social. And we have other benefits designed to address the other pillars as well. Most of our plans, for example, offer a fitness benefit, right? They can either do exercise at home with videos on tablets, phones, or they can do the activity in a participating facility or gym. And this helps address both physical and social. And then lastly, many of our plans also have transportation benefits, Eric. So this allows our members the ability to get to areas for social interaction, like shopping malls or places of worship or senior centers. We just recognize the fact that if they can get somewhere they can gain interactions, they don't feel so alone.
That's great. So Grant, I just want to, because someone asked the question, I'll repeat it. It's Papa Health you're referring to. Your connection actually in the pre-production meeting was fine. It's a little choppy. So I know you got a gap between I bring you back in the conversation. I don't know if you get closer to a router or not. We heard you, but you were just a little bit choppy. Just know that. So that program he was referring to, just folks, if you didn't hear it, was called Papa Health. I want to talk about SCAN Health Plan now and bring in Sophie Howlett. She's the manager of population health there. If you don't know about SCAN, they're in California. They're a Medicare Advantage plan. They do a lot of interesting, innovative things. And I know you're creating a scalable, innovative program to combat loneliness and other social determinants. Can you tell us a little bit about your member-to-member program and how that works?
Oh, sure. So just to say, first off, thanks for having me. But also, yeah, we've got a lot of programs targeting our members and helping them with their social determinants of health. For example, like transport benefits and meal benefits and connecting them to community resources through Find Help. And we have a housing support program which offers care management for our members who are housing.
Hey, Sophie, I'm sorry to interrupt. I'm going to ask you. I told you it was going to be informal, right?
Okay.
Can you try to move your mic a little farther away because it seems to be hitting something? Or
Too close.
Getting a little bumpiness there. Yeah.
Is that better?
Yeah. I swear we tried testing all this before we went live. Every so often. Go ahead, Sophie. I'm sorry. Try now.
Is that better? Sounds good.
I think so. It's a little bit better. Yeah.
Okay. So yeah, we've got a housing support program which offers our members care management to get connected to housing. But we've also we have a togetherness initiative which is hoping to help our members combat their social isolation and loneliness. But our member-to-member program, to get back to your question, was it's a core program at SCAN, and it's really based on peer-to-peer interactions, which maybe some of you know is kind of one of the hallmarks of SCAN's care model. So we have our SCAN, what they're called peer advocates, and they're SCAN members who are hired as SCAN staff, and they do outreach to our members on kind of the more difficult to talk about subjects like mental health or urinary incontinence and falls. And the goal is to kind of equip our members with like the toolkit and skills to be able to advocate on these like difficult topics with their providers. So it's kind of like a coaching program. And we did an evaluation of this in 2020, which found that it improved on like the members' responses on a range of like HOS cost measures like talking to your provider about physical activity, talking to your provider about falls and urinary incontinence. So that's great. I mean, who best to help you talk about these things than your peers, right? And the team, actually, they've been so instrumental in a lot of our work. They're very outspoken. They've had illustrious careers of their own, and we're just so lucky that we have their skills and experience as an asset to our SCAN team. So yeah, that's the program. But just I want to really talk about the Togetherness initiative that we launched this year and a little bit of last year. We have a friendly caller program, and
Can we get to that later? I want to bring
okay,
friendly
I'm
caller
very
program.
excited to talk about that.
So am I. I was telling another panelist that's going to be one of my favorite answers, but I want to wait for that. So thank you. And a quick question. So the member, are you actually taking existing members within the health plan and then recruiting them to be volunteers to be part of this program?
Oh no, they're paid staff on our they're part-time staff, and they get hired the same way everybody else gets hired. So they apply and then yeah.
As far as was this a main driver to getting you from 4 to 5-star rating?
I don't think we have the data to say that, but it's just something that it's a program that's really helped, like it's core to our mission. It helps our business. We just love having them as a on our team, and the team has just grown and grown, and they keep getting recruited to do other things, and they want to get involved in everything. So it's hard to stop them, really. So
Wonderful.
yeah.
So I want to transition and expand a little bit around whole person care and around getting more partnerships with the community. And I know there's probably a lot of people in the audience that have partnerships with CBOs and various other community organizations. I want to bring in Kendra White. She's the Senior Manager of Community Relations at UPMC for Life and UPMC Health Plan. And Kendra, can you talk a little bit about how you guys are partnering with organizations, churches in particular, and leveraging those community settings to not only understand the members better and understand what the environmental kind of challenges they have in their life, but also the closing the gaps in care specifically?
Yes, thank you again, Eric. I'm honored to be here today to talk about this. You said talk a little bit. I mean, I could talk a lot. So it's really exciting. I think over the last 17 years, I've been very blessed in this role to have worked to build a community outreach team across the state of Pennsylvania. We really focus on meeting our members where they are. So that's, multifaceted and building trust that aligns with our vision and values as an organization. So that's in the heart of everything we do. In 2019, one of my colleagues, Dr. Camille Clark-Smith, started an initiative called the Medicare Healthy Church Challenge. And this actually has been a phenomenal undertaking for us to just do everything I just said, building that trust, working on those, not only addressing those social determinants of health, but, fine-tuning the education around the importance of working with your primary care physician, getting those preventive screenings done in a regular basis, having a little fun, being with your peers in the church. We had some parking lot parties prior to COVID. We were able to continue this during COVID in a virtual way. Because I think someone said it, we'll talk about it more. Technology was something they had to pull the Band-Aid off and learn how to use this older generation. I know my parents, same thing. They didn't even know how to FaceTime. So it's been a learning experience in that regard. But we did have close to 400 participants in the church challenge in 2021. We closed gaps in care for our members, but even if they weren't our members, they weren't excluded from participating. So, the overall messaging was phenomenal and just increasing their self-efficacy with identifying some health needs that they may not have realized that they had, and things they can address before there's a problem, before they need to go to the hospital or the doctor. So that's very important and, particularly aligns with the mission of UPMC as a whole.
So I like this whole theme we have going, community-based, home-based type of initiatives to just close gaps in care and provide better whole person care. So I want to bring in Evan Falchuk. He's the CEO of Family First. And Evan, how are health plans and healthcare organizations, how could they better achieve and activate at-home care by leveraging the caregivers to provide better care, the patients and the members, individual family members and friends? How are you better activating them to provide better care inside the home?
It's a tremendous untapped resource. And, for those of you who haven't seen it, I really commend, there's a TED talk by a doctor named Dixon Shabanda from Africa, from I believe Zambia. And he really was dealing with the issue of a crisis in mental health and enormous numbers of suicides happening and a complete lack of psychiatric and mental health resources in his country. And what he did was recruited grandmothers and trained them with certain, CBT-like modalities to help. And they've had an enormous impact on people in his country, and it's spreading to other parts of the world. You should really check out that TED talk. And part of what we're dealing with in our country and with the aging population especially is we don't have enough clinicians, home care workers and others to deal with these problems. And who else is there? Well, there's the family, there are the caregivers. And what we're focused on certainly here at Family First, but I think that this is something that everybody should be thinking about, is how do we engage families to be the caregivers, help cut through all the challenges that families face in being a caregiver, because there could be family dynamics, there could be clinical and non-clinical issues and other problems that are getting in the way, and you need help to do that, and you can really leverage it. So when I think, this is me putting on my business hat in terms of what plans can do, I think it's really valuable. I think as a marketing differentiator to tell people that are buying an MA plan, if you are smart enough to enroll in our plan, your family is going to get help to take better care of you. Which means also in the context of enrolling folks, like find out who their caregivers are and maybe reach out to those family members and say, hey, I've got help for you to do a better job taking care of your loved one, and really engage them in the process. So we need an army of families to be engaged in the process of caring for their loved ones. People want to do it for the most part anyway, and many of them are. But the more help we can give them, the more impact we can all have to better their lives.
Thanks, Evan. So,
Eric, can I add to that? Evan made it's Grant. Evan, great comments. We struggle with discharge planning too, right? We've got case managers working, getting them out of the hospital, and yet where do you go, right? They try to go home, but if the family isn't ready or doesn't have the skills. So this country doesn't, you mentioned the TED Talks, you're right, it was referencing a different ethos, really. And we need to get a shift in this country of recognizing the value of family taking care of family. And I think as plans, as different organizations, we have to educate the family on what they can do. Because to your point, they need to know how to do it before they can do it, or putting the safety of the member at the patient at risk. And so we really, it's a combination of all that. But I agree with Evan's comments, Eric. We have to get family involved more.
And that's a perfect segue, like you're almost moderating for me. I want to bring back in Sophie Howlett. I know, Sophie, that you have this caregiver initiative. So I'd love you to talk a little bit about how important it is to assist in the member's entire support system, and then maybe give us some insight on how SCAN is measuring that program.
Yeah, well, I couldn't agree with Grant and Evan more. Like, it's so important to wrap our arms around like the people actually providing the backbone of the health for our members, our membership. So SCAN has a caregiver benefit, a caregiver initiative, which basically extends our member benefits to the caregivers, offering them care management and workshops in English and Spanish and just social support to really like help them navigate the journey. Like, often people find themselves as a caregiver kind of not by choice, and they kind of fall into it. So really, we want to give them the tools to help support our members. We launched that program this year, so we really kind of want it to be iterative, and we really want to hear from the caregivers themselves what they need. So we're kind of dipping our toe in the water and really want to work with the caregivers themselves to see what's actually helpful, because I know there's a lot of didactic kind of training and stuff that you just don't have time. They don't have time for, and we really want to be the best like support we can be. And so I think it's going to be a process to learn how to measure it, in fact, and like so it's a process. But yeah, it's so important to support our caregivers.
All right, good. And I am going to ask you about the Friendly Callers program later. So I want to hear a little bit about what UPMC Health Plan is doing. So I'm going to bring back Kendra White and talk about how you are, better leveraging community settings to understand Oh, sorry, I already asked you that question, Kendra. I'm sorry. I want to bring it. I want you to talk about your powerful tools for caregivers program and how
Sure. And just to echo what Sophie said about the need, I mean, it's unbelievable, the statistics of, the caregiver becoming yet another, morbidity and mortality is higher. They don't recognize that they might be becoming another, statistic to needing care. So probably around 13 years ago, we were at a symposium and it was about this book called The Powerful Tools for Caregivers. So we took a little step further and discovered that it's actually a 6-week standardized program that was developed out in Oregon at the university. And it's all about taking care of yourself while you're caring for someone, whether it's, a child, a spouse, a parent, whatever that might look like. And it's a 6-week course, and every week builds upon that. And it just goes through, all the feelings of fear and guilt, depression, how to make time for yourself, and that it's okay to make time for yourself while you're caring for a chronic condition, a loved one with a chronic condition. We started offering that to our membership. And, it's a 6-week course. So our members and their families can participate for no cost. And we would do them in community-based settings. And we probably touched around 3 to 4 caregivers a year in that community program. A week before COVID actually hit over on when we took our first shutdown, so to speak, in 2020, we were piloting a virtual option with this class, and we knew there'd be hiccups, and we had tech support on board and ready to help. And then we got everyone on board. There were 6 participants. They were so excited to be piloting this with us. And then the following week, it was like, well, good thing we did this, because here we are. We can't be in person anyway. And so that really opened up a lot of conversations and some policies and procedures that we were able to put into place to be able to continue it from a secure and virtual platform. And just to be able to expand that. So, that to us, it's a big commitment to address the caregivers. We actually partner with an organization in Western Allegheny County, which is near Pittsburgh. It's called Hope Grows. They're a small nonprofit that has been growing. And, exponentially in 2021, they served 999 caregivers, and they provided hours of telephonic support. Post Powerful Tools for Caregivers, that 6 weeks, when it's over, they provide a conduit for continuing that support. If they can have a telephonic therapy session, those types of things, staying connected with their programs. They have a respite house that will be opening this year where caregivers can go and just take a break. And, whether it's for a few hours or overnight. So to us, that aligns again with, taking care of the person, whether it's our member or not. It could be, a family member that might be on another type of plan, but it's all about taking care of the person as a whole. So we've been very proud to be a part of that program, and also looking at ways in our communities that we serve where we can expand those opportunities. Because, and also, people don't identify as caregivers. They say, well, I'm taking care of mom because I have to. Well, you need to take care of yourself as well. So it's a very important health issue that we will continue to address.
Amen. It's great. So, I'm gonna call an audible here and give you guys a little bit more information about our sponsor, which I was going to wait, but it just seems like the topic's right. So one of the beauties of my job here as the host of this show, and we're doing this now for since since 2014, so going on 8 years, is we've grown enough from all your participation to be able to choose the topics we want to cover based upon what you want us to hear, and then bring in organizations that want to support the podcast so we could continue to provide this programming for free, but tie it into expertise on the programming that we want to provide all of you. So I was really privileged to be able to land, bring in Family First into our ecosystem here. I mentioned them at the beginning of the show. They're at family-first.com, but they're doing exactly this. They combine this technology-powered caregiving solution that allows them to integrate clinical data and STOH, and then they provide that information with a crackerjack team of multidisciplinary caregivers to craft and implement care plans to solve Medicare members' most urgent caregiving needs and close these gaps in care and increase member satisfaction and enable the caregivers to live healthier, happier lives while taking care of their loved ones. So one of the things I will say about these guys, and full disclosure, I used to in a past life work with both Evan Falchuk and his lieutenant, Chad Yarman. They're just good guys. They're good guys, they're smart, and they live and breathe this. So when the survey comes out in about 15 minutes, you could, if you want an introduction to them, you could request it. And you don't need to feel pressured like, oh, I got to meet with these guys. They think that I'm going to buy their services. I think they're just good resources to have, good contacts to have, to learn a little bit about what they're seeing in the marketplace and some of the tricks of the trade that they're implementing to support caregivers that you may be able to implement at your organization. And if you think the relationship is worth it going further, that's up to you if you want to discuss with them how to bring them into your health plan or provider system. So shout out to Family First, family-first.com. It's organizations like that keep this show going. So thank you for all of that. One last housekeeping announcement. I'm getting some questions about recording of this episode. Yes, we record it. In fact, if you subscribe to the podcast, wherever you consume podcasts, Bright Spots in Healthcare, you will get this show on your tablet, on your phone, within probably 24 hours. We also have a YouTube channel where the raw video footage of this, you're stuck looking at me again, will be available to you immediately after the end of the show. And then we'll also send you a link to the recording on our website within about 24 hours. So you're going to have all kinds of access points to get this show and listen to it again, for those of you who've been asking. Final thing, please keep your questions to the panel in the Q&A module so I could better manage them along with Sherry, our producer, and we'll be able to answer them through that versus the chat, which I know the chat's been pretty active right now, but it's hard for me to scroll through it all and capture all those. All right. Let's keep on going. There's been some questions around gaps in care. So this is what I'd love to do, Evan, not necessarily planned, but I want to talk about caregiving and how better trained and supported caregivers could close gaps in care, increase STAR ratings. Let's talk a little bit about what CMS is asking of health plans, and then maybe provide us an example of that, of how you support a caregiver in the trenches.
Yeah, I mean, and look, I think the first thing to say is that caregiving is really hard. There are so many aspects of it that are just heartbreaking for the person that's dealing with it. Trying to navigate the healthcare system is almost impossible. Knowing what resources are available when you're a caregiver, and we just don't do a great job as a country planning for caregiving. There was a report that came out by Blue Cross of Pennsylvania, I believe, talking about the economic impact of all that, and it's enormous. I think we'll be able to share that with folks.
Evan, that's actually a good point. I do have that study, and I actually have another study that the Medicare actually published on caregiving impact. So I'm happy. Why don't I do this, Sherry? I'm probably putting you on the spot here, but in the next couple of minutes, throw up a poll, and anyone that wants me to email those PDFs to them directly, I'm happy to do that. So.
Cool. Yeah, and I think that, when we think about the conditions that people are dealing with, we see a lot of people calling that are taking care of a loved one that's got dementia, for example. And the impact of that is really, it's just devastating on families. And again, how do you even recognize what the problem is, what to do about it, how to handle it, what resources should I use? So we had a call. Our services are expert help for caregivers in these situations as a benefit. So it's free to the people calling. And they talked to one of our care experts, but we had a call of a woman who was prepared to set up her mom with 24/7 care at home because of her worsening dementia symptoms, and was asking for help with how do I coordinate all the the resources to get 24/7 care. I'm not sure how I'm going to pay for it, but it's what my mom needs. I'm the only caregiver. By the way, the impact of caregiving falls absolutely disproportionately on women, and in ways that are they just affect so much of our society around on the unfairness of that and the impact that it has economically on people, and we see that all the time in our work. But in talking with the daughter, who was the one who had called us, we found out that the mom has multiple diagnoses. She had multiple lists of medications that she was compliant with, but that none of the doctors were talking to each other about these things. We were able to collect her medical records and see that there was a possibility that her worsening symptoms were caused by a medication interaction. Once that was cleared up, because we were able to tell the physicians, FYI, there's this interaction happening, she went back to a baseline, the mom did, where she still needed some help and still has dementia, but not at the level that was going to cause 24/7 care. So when we think about this question of improving star ratings and customer satisfaction and really outcomes at the end of the day, which is what I think we're all focused on, getting that kind of comprehensive, holistic look at what's going on with this person, and help that caregiver see the problem for what it is before they start acting on it is everything. It's something that happens in every walk of life. Make sure you know what's wrong before you start doing something about it. And I feel like what we do and what I think all of us are trying to focus on in the different ways we're tackling this is to figure out what's happening. Let's help the caregiver, train them to do the things that they need to do, but let's make sure it's the right things. And to me, that's the best way to approach this.
Great. I want to transition a little bit to now care at the home, treatment at the home, and not just the caregivers themselves. And I want to bring back in Dr. Tarbox, and we're also going to bring in as well Ellen Bjeckford, who's the Associate Vice President of Population Health and Clinical Transformation at UPMC Health Plan. So I'll start with you, Grant, and how are you guys providing at Cigna better clinical care at the home?
Yeah, it's critical that people are accessing care in so many different ways, right? Home is becoming unfortunately now the new norm, right? I don't think it's going to go away even when the pandemic becomes lessened. We're still going to see, thankfully, the proper use of virtual cares. I want to address one of the things real quick, Eric, were some of the comments in the chat. People were asking about access to different services. And one of the things I'd be really remiss if I didn't call out was, especially our case managers at the plans and the different organizations, when we try to reach members, they don't call us back. The phone number gets ignored. I get it, right? It's a health plan calling. People don't want to pick up. Are they going to sell me something? What are they going to talk about? We just want to reinforce the importance of we are there to partner with you, right? And we have so much what we call UTR, unable to reach, because we have a bad number. It's critical that we have proper information. So it starts with communication. So with regard to care at home, absolutely. First and foremost, we know there's a definitive link between physical and mental health, right? And the pandemic, it's significantly increased anxiety and depression with people living in isolation for long periods of time. Plus, on top of that, as others have alluded to here, many of them suffered the loss of friends and loved ones to the virus. And on so many occasions, these people were the support network for the member, right? So now they're gone. Now what do they do? So with regard specifically to care at home, and specifically to behavioral health, because that's been a huge increase in needs and services during the pandemic, Cigna rolled out the virtual behavioral health plan for Medicare Advantage members at a $0 copay, right? To make access easy. The access is even easier because they can do it by traditional phone, smartphone, tablet, computer. I think there's a perception, and one of the comments in the chat was about an 88-year-old mother. Mine is 88 as well, and I get more emails than I think and texts from my mother. So she knows how to use technology, but there's a perception that people of Medicare age have an issue with technology or don't adopt it or adapt to it. So this barrier was definitely impacted by our PAPA PALS interventions as well, right? But specifically to our BH and our behavioral health and our senior population, we saw an uptick of 6,000% from pre-pandemic levels in the use of virtual care for mental health, right? So huge adoption of using virtual care, getting care in the home in the place that they're comfortable getting it. Now, I want to call out, I'd be wrong if I didn't call this out though too, because sadly there is still a huge stigma around mental health care, right? Definitely for older adults. Younger adults, thankfully, more and more of them are comfortable talking about it. But our older population, this type of virtual care helps address these issues by ensuring greater privacy, and they don't have to sit in the waiting room wondering if someone is looking at them, wondering what they're there for. So that's one of the primary ways Cigna is trying to combat that barrier of home versus clinic and push care out to the home to where the member is sitting.
Thanks for that. That was great, Grant. Well, so you teed up mental health and behavioral health really well for Ellen. So Ellen, what are you doing at UPMC health plan around your Resources for Life program and supporting Medicare Advantage members at the home?
Sure. Thanks so much again for having us on, Eric. And I think I can really build on what Grant talked about. So we have a program at UPMC Health Plan for our Medicare members called Resources for Life, which offers a variety of services that are pretty comparable to what an employee assistance program offers, but this is for our Medicare members. And late in 2020, we introduced a program within Resources for Life that gives our Medicare members up to 6 counseling sessions on any topic per year. And that can be renewed for more sessions on a different topic. But we saw a really big uptick in utilization of those counseling services through Resources for Life, really starting at about the middle of 2021. We've served several hundred members. And Grant, to your point, historically, initially in the first about 6 months of this service, the most common presenting problems were stress, depression, and anxiety. And I think that that's reflective of, the pandemic is not causing a dramatic increase in mental health diagnoses, but certainly a dramatic increase in distress and stress and affecting mental health in lots of ways. I don't mean to underestimate that, but stress was the number one topic, followed by depression and anxiety. In 2021, grief took the third spot, overtook anxiety as the third most common. Anxiety is now fourth. And I think that just reflects the overwhelming number of people who have been affected by loss during the pandemic. So these counseling sessions, which are delivered via synchronous video, so convenient, providing a bridge of sorts in some cases to longer term mental health or behavioral health treatment where we know access was an issue before the pandemic. I mean, we've underinvested in behavioral health infrastructure sort of since the beginning of time, in my opinion. And now we're trying to catch up, and it's not going to be easy. And we've got a lot of work to do. Some of that relates to the stigma, Grant, that you mentioned, which we have to keep talking about. We don't just have to normalize access to behavioral health treatment. We have to celebrate people for taking that important step to take care of themselves. But we have seen a lot of utilization of this service. And interestingly, more than half the time, almost 60% of the time, those 6 sessions are sufficient for the member to feel like they've got their issue handled and they feel like they can handle things on their own from there. About 10% of the time, they go on to receive other clinical services provided by the health plan through our health coaching services or other care management services. And about 10% of the time, we connect them to a longer term source of care for ongoing psychotherapy or mental health counseling. But we've been really happy to be able to bring this benefit to our members at a time when we know it's really needed. And we've been pleased that majority of the time, it seems to resolve the issue that people are dealing with. And if it doesn't, we're able to connect them to services that they can use on an ongoing basis.
Right. Yeah. I amen to everything you just said. You health plans out there in the audience, we need you or the government to start creating funds to subsidize professionals that go to school to become social workers, to become psychologists, to become psychiatrists. That's how we solve this problem. It's not going to be necessarily in our lifetime, but we need more providers.
And we definitely, sorry to interrupt, Eric, we definitely need to incentivize those providers to be located in rural and remote areas. And that's my comment on that.
No, you're right. Can I jump in? She's right. We've got to get access in the rural areas, and that's where the virtual health is certainly one of the inroads. And Ellen, one of the comments you made that grief topped the list in 21, not surprised, right? People are grieving for all sorts of reasons, things that we don't typically consider grievable. Loneliness, right? Isolation. So hopefully we're coming out of this, we're going to see that number fall. It's not going to be grief at the top anymore, but I'm glad it's begun the conversation. It's made it more palatable to discuss the mental health situation and the stresses everybody is feeling.
Yes, and I know, Eric, you want to keep moving, but if I can jump on real quick to say, I appreciate what Sophie said, and Grant as well, making sure that we give access to physical and behavioral health and mental health care in rural areas, and thinking about telehealth as a solution to that. Some of us on the call, not all of us, have been around long enough to remember when the digital divide referred to people who did and didn't have devices. And now I think it really is more about people who do and don't have access to broadband. There are still major, even here in Pittsburgh, we have pockets of broadband deserts. Sometimes that's infrastructure, sometimes it's financial resources to have broadband internet. But I know that the FCC and there's a lot happening with respect to trying to bring more equity to broadband access, but that is absolutely instrumental to making sure that telehealth can realize its full potential when it comes to improving receipt of care in rural areas.
Yep. But let's talk about health equity. And so let's talk about health equity, and let's talk about how STOH is key to kind of using that data to create more equitable programs and drive more positive results. And I know it's not just about the broadband, that's a huge part, but also making sure that we get individuals who may not normally have regular access or feel the trust of the healthcare system connected with a provider to make sure that they're, let's say, taking their medication regularly. So let's bring back in Sophie and talk a little bit about what SCAN's doing with their health equity and medication adherence programs.
Yeah, I'd love to. I'm very proud. We have a health equity program at SCAN, and I was the one to champion it when I came here to SCAN from Australia, and I saw it as a big gap, something we weren't addressing or talking about. So in the last 5 years, we've really built a great program that continues to iterate and evolve. And I think there's going to be a lot of work in this space for a long time. But to your point, Eric, underpinning this whole program is gathering the good data and standardizing the data and building the infrastructure to have that underneath all your programs. So that we've done a lot of work on that, like building dashboards and implementing a health risk assessment for our non-SNP members and kind of standardizing the questions we input around social determinants of health and that kind of thing. So we have a view of our population across the population, and we can see their demographic profiles and really kind of get line of sight on where those gaps are. And so one example of where we were able to do that was in medication adherence. When we looked at the population, we saw that for the medication adherence measures, our Black and Latinx members were, the metrics were poorer than our white members. So we went in and consequently tailored programs to better improve these gaps. Mostly that meant actually sitting with our members and talking to them and listening and hearing what those gaps actually look like from their perspective. And then we went and designed some programs to really kind of tailor to those needs. And the goal was to reduce the disparity by 25% in 2021. And at the end of 2021, we had reduced it by 35%. So we've done a lot of work in that area and really listened to our members and prevented heart attacks and strokes and deaths. So the bottom line, I think, for health equity, for any health plan considering it, is if we're not here to improve access to care for our population, I'm not quite sure what we are here for. So.
As it relates to social determinants of health, and Evan, let me throw this one at you. What are areas of STOH that maybe health plans and providers often overlook or miss in a way that they could effectively make sure that you're able to not only bridge health equity, but get all the necessary resources to a Medicare Advantage member.
Yeah, I mean, so much of this falls on the question of the SDOH of the caregiver, and I completely understand that no one's getting directly, compensated to take care of this from a Medicare perspective, but this is a huge issue. So, a good example is a case we had recently of a woman who called. She said, I really need help taking care of my kids. I've got 4 kids, and I'm having trouble managing where to get them, for during the pandemic and everything. And so we're like, oh, okay. And we talked to her and found out that she's the primary caregiver for her mom, who has a complicated and not exactly well differentiated diagnosis, in terms of her health. She's got a spouse who's got a substance use disorder, who's of no help, and she's working full time. And the breaking point for her was the care for her kids. But the situation that she's dealing with is unbelievable. And, in many ways, she's a hero, even though she didn't really, as Kendra put it, she didn't define herself as a caregiver. She just was a stressed, overburdened mom. Well, there's an opportunity in that to take a step back, look at the big picture here, and figure out if she's the primary caregiver for her mom. She needs to have tools to help her manage through these incredibly complicated issues that she has. We don't have an integrated, healthcare system that figures out a way to solve these problems. But we have to take people where how they come to us, and what is their breaking point that causes them to say, I need help. And it's different for everybody. Some people may never ask for help, and the balls are dropping as they're trying to juggle everything. So when I think about SDOH, I think we have to look at the question of the caregiver. I think that I would like it. I mean, Medicare or CMS just came out with their announcement that they were going to be doing a rulemaking on health equity, and we're going to be looking at differential premium levels for folks that address health equity in whatever way they end up defining it. I think it'd be important for all of us as advocates, as people in this industry, to try to get attention paid from a government perspective on this issue of the caregiver, and how do we address the issues that they need. The last thing I'll say is that there's a financial impact of this stuff and people not getting help. We did a study of our casework with Milliman, the actuaries, that found that people where the caregivers got help, the person being cared for had a longer life expectancy, which makes logical sense, but it's amazing to hear actuaries say that. And we've got some really good data showing that there's less utilization of healthcare services by the people being cared for in these situations, which again makes perfect logical sense. The question is, how do you bridge that gap, get in front of those caregivers and help them? And I feel like we have an obligation to do our part to help this happen systematically, not just at the level of an individual business.
Hey, Evan, is that Milliman? Is that like a proprietary thing, or is that shareable?
It is, but there's definitely a summary that we can share. And if folks want to get in touch, we're glad to share that with you.
Well, why don't I'm Sherry's going to kill me. Why don't we put another poll up? See who has that number.
All right.
We'll get that up in the next minute or two. I'll stall for her.
Sure.
Awesome. Thanks for that. We'll get that over to folks. So I want to talk about empathy, because I think a lot of what we're talking about starts with an organization having the right strategy and culture. And I'm a big believer that empathy should be a core part of any health organization strategy. And even though everyone says empathy is a part of their corporate culture, I'm not 100% convinced it truly is. And so, an empathetic organization drives exceptional whole person care programs. That's my thesis or my hypothesis. So, Sophie, I want to bring you in so you could talk a little bit about how, where we're going now, right? How SCAN is both strengthening their culture of empathy, but also enabling them to be exceptional in providing a great MA member experience and drive better whole person care.
Yeah, thanks. I do want to say though that it's hard to mandate empathy. You have to kind of build it and lead people there. So one of the things that that we have at SCAN, I think just basically as a good starting point is like the core belief that everyone shares is in the mission and helping our members, and comes up in every meeting. And it's one of the joys of working here, to be honest, is that like everyone's always like thinking about their parent. What if this was my parent? What if this was my grandparent? And actually many of their parents and grandparents are SCAN members. So that, I think having that as like your baseline of everyone's kind of level is a great starting point. And then we have implemented the Togetherness Initiative, which I mentioned last year, and then continuing that this year. And so we introduced a Friendly Caller program, which is all SCAN employees volunteer to have a weekly call, social, just purely social chat with a member, and they commit to that for 6 months. And they're matched, members and staff are matched based on their interests, like art or books or gardening or that kind of thing. My member is we talk about gardening, so that's one of my pleasures and hers. And so it's just really lovely to be connected to the mission and to your membership in that way. Like it really, so you're living that, and you hear their life, and it's just like a really great way to directly connect employees to why we're here, you know. And both members and staff sing only praise about like the person they're connected to, and about the program itself. The overarching goal of the program, though, is to help our members feel socially connected. And I mean, many older adults don't talk to anyone all day, which is really kind of frightening. And we all know that this is being amplified by COVID. But in the program, we're doing a pre and a post assessment at start at intake, and then at 6 months, and we're using the UCLA loneliness scale to kind of measure success. And between that and the member satisfaction and the staff engagement and satisfaction and the number of people we can outreach to, they're all our metrics of success. But overall, between the Togetherness Caller and the learning communities that is virtual social groups that we host as well, that we're hoping to see a reduction in the UCLA loneliness scale by 20%. So we'll keep you posted on that. So yeah.
I love it. It's one of my favorite things I've heard. One of our audience members just asked if there's a way for non-SCAN employees to volunteer for those weekly calls.
Potentially, but we're not sure how we're rolling that out yet. But yeah, we're definitely working with Independence at Home is our community benefit arm at SCAN, and they're doing a virtual senior center as well. So we're kind of doing a lot of collaborations on that. So watch the space, I would say, on that.
I see we have some more questions coming in. I'll try to get to a couple here at the end. I want to bring in back Dr. Tarbox at Cigna. I know Cigna's huge, right? And they have tons of resources. I also know sometimes like having like that call program, it's often less about the resources, the money, and more about just thoughtful, pragmatic approaches to better engagement and supporting better behavior for those struggling with any social challenges they have. So I'd love to hear what Cigna's maybe doing that would fall like into the simple yet successful category to drive better engagement with members, maybe offset loneliness or any of the other social determinants that you're often trying to tackle.
Yeah, great. There's actually two things that come to mind I want to mention, but you're right. Okay, Cigna is a large organization, right? We have a lot of resources, but rather it's about using the resource. Any of us on the call, any payers, any of the organizations referenced today, it's about using those resources to make an impact on one person at a time, right? That's how you build. I think the hospital was mentioned earlier, patient satisfaction, provider satisfaction, one person at a time. We leverage our abilities to make a difference for each member. So yes, a couple of unique ways that we've sort of tried to engage, bring the members to a more social environment in some kind of interesting but different ways. We actually just hosted the world's largest bingo game. We're in the Guinness Book now. We partnered with Televita. We brought together almost 2,700 members from 26 states, like 125 organizations. They joined from both home and from senior centers to connect socially and just play bingo, right? I actually participated. It was a lot of fun. I didn't win the bingo, so no, if anybody asked that question. But it was a great way to get people not only to do something social, right, but it enticed them to try the virtual realm, to get out there and do something that didn't take a lot of education or training, like learning a new card game. It's bingo, for goodness sake, right? Everybody knows how to play that. Great response. I think we're going to do it again. I think we definitely should do something like that again. Other programs we have that impact loneliness is one we've been doing for several years. Okay, this is one that we've had success with and we've been repeating, and it's called our gratitude mailing. Now, near Thanksgiving every year, we send notes of thanks to our members, right? Thank you for being a member. We appreciate you. I think people don't hear that enough these days, sincerely, right? Sincerity is key, right? But we're telling our members we appreciate you being there as our member. And we also include 3 stamped envelopes and cards. And the cards are in Spanish or English, depending on the language preference, right, of the member. But we then encourage them to share these cards with their family and friends, because we have shown, there are many studies that display the fact that showing gratitude also improves mental health. So these are kind of unique ways where we're trying to really take a different approach, a differentiated approach to tackling loneliness, recognizing individuals, and helping them reach out to family and loved ones.
Love it. I love that. Let me, we're going to go sort of off the playbook right now, or outside of the playbook, I should say. Can any of you on the panel comment on how your supplemental benefit offerings, the in-home support, the meals, trips, have influenced member retention or star ratings? If you don't have specific quantifiable results, maybe just speak to it, subjectively. Silence.
Well, I want to make sure I understood your question. You're saying, could you say that again?
Yes, I will. Sorry, let me pull it up again. I'm managing 2 screens here. Let me make sure I get it right. Can the panel comment on how the supplemental benefit offerings have influenced your member retention and star ratings?
Okay, yeah, well, I can definitely jump into that. I mean, stars are critical. It's not the only thing, but stars are something that every health plan uses it's a way to measure the test, right? How well you're doing it. And the stars ratings change from year to year. So we definitely pay attention to that. But the benefits design, unfortunately, there is a combination out there of, well, what's the competitor doing? What do we have to do? We're trying to peel away from that and instead get to a level of what's right to do. So whenever we're looking at a new benefit, whether it be chiropractic cares or vision services or some new thing on transportation, we have to challenge ourselves and say, should we be first to market with this? Is it the right thing to do? Can we afford to do it? Because everything comes with a cost, right? Not necessarily the member, but it does come at a cost to the plan. But I think more and more plans and more executive leaders in the companies are taking the approach, Eric, that we want to start doing more. We recognize that Medicare, if you look back historically and see the changes Medicare has made to the health of our senior population, it's an amazing success story. With all of its deficiencies, it's still an amazing, bright, shining star, right? And so we just need to find ways to continue to expand the services and find a way that their adoption rates are high, such that we can garner membership. And of course, we know that helps pay for services.
That's great. Thank you. One more question from the audience. So Tiffany says another large burden for caregivers is the financial strain, which adds to mental stress. Any suggestions on how to relieve this? Evan, you want to take a stab at it first?
Yeah, I mean, look, on one level, figuring out what's wrong can help you make sure you're spending those dollars that you might have effectively. Like the case I mentioned, 24/7 care is a heck of a lot more expensive than, a few hours. One of the things that we spend time on, and this is really back to that SDOH for caregivers issue, is try to figure out what resources may be available for that individual. I mean, we can't assume that everybody has, because most people have not saved tons of money, have long-term care insurance, qualify for Medicaid, all these other ways that people are able to pay for things. So, we work hard to find resources in the local community to, again, help the caregiver. So it may be, listen, I can't go see my mom because I can't pay for gas and figure out how to feed my kids. I mean, I've we've seen cases like this. And again, it's really, it's heartbreaking. And it's amazing that we don't have resources for folks like that. But one of the things we do is let's find you ways to get meals. Maybe it's a food pantry. Maybe there's a place for her to get clothing that might help you alleviate that burden. But again, we've got a major problem on our hands as a country around making sure that caregivers are paid attention to, recognized as the incredibly valuable resource that they are, and are given the tools that they need to help take care of the people that we all serve, and who took care of us. This is really about that population of human beings who are really, so crucial that we have an obligation to help them.
Perfect. And
can I just jump in and say that, like Evan said, we're not reimbursed to support our caregivers, but that's like not yet, and it's up to us to make that happen.
Amen.
There you go.
Your closing comment. I want to first remind everyone that if you subscribe to Bright Spots in Healthcare, wherever you consume podcasts, you will get this episode downloaded to you within 24 hours. Share it with your colleagues, your friends. We also will send you a link to the website recording within 24 hours. I don't want to hold Sherry to 2 months. I think we do that within 24 hours. And please take that survey that's in your inbox right now if you haven't already. I know an hour of your time, even though these are free events to attend, is still pretty darn valuable. You're busy and you're all working and probably getting compensated handsomely. So I really do appreciate the hour you spend with us, whether you're listening right now on the podcast or you're here live on Zoom. We do not take the time for granted, and we hope that we've delivered some value to you in the 60 minutes. I want to thank our incredible 5-person panel, how hard you worked with me ahead of time to prepare for this, to make sure that we were focused on these success stories and bright spots. I really appreciate the time you spent prior to the show and during this hour. It certainly showed. Thank you to everyone. This will mark the end of the show. This has been your Bright Spots in Healthcare podcast.